Does anyone have any questions?
Wow, not one?
Okay. You'll be second, all right? Try to keep personal history out of it as much as possible, and keep it just to a simple question as much as possible.
My wife asked Chiari, can we find a doctor that deals with Chiari in Michigan? Detroit surrounding area. We want a doctor.
I'll be happy to see her.
Oh, you're around here? You're right here?
Yes, literally here.
Great.
You mentioned a little bit about, I guess, the research that's being done. Can you, I guess, elaborate a little bit more? I was just talking to Shannon, and she said that Duke had, I guess, a study or a clinical trial looking into the genetics behind the familial form of Chiari malformation. So can you just talk a little bit about it?
Sure. No, Duke is trying to isolate the gene that results in Chiari-1 malformation, and CSF Foundation has been supportive of that in terms of trying to find literally a cure for Chiari. Separately, we have a lot of clinical research looking at, for example, why are so many patients asymptomatic? Because you know every patient with Chiari malformation doesn't even know they have it. May not have symptoms until something happens, a car accident, a fall, a blow, an assault, and then the symptoms don't go away. We'd like to answer the question, what symptoms are most likely to respond to surgical decompression? And so we are keeping all of that clinical data for that.
Any other questions? Last chance? Any other questions?
There will be.
There'll probably be one for you. So, thank you so much, Dr. Gilmer. We really okay.
Just
We
real
won't thank
quick.
her yet.
Real quick, I wanted to know, I had the decompression surgery in '09, and I still have problems, and I have a lot of problems swallowing. It's so hard to swallow. And so I just wanted to ask about that, because I just keep wondering, why it's just still really hard to swallow. And I still have the pain and the headaches and stuff, but, you know, I just don't have a doctor. I have a neurologist that says, well, you have Chiari, that's the way it is.
Got to add that to my list. Have you had an MRI after surgery?
I had one in 2010, right after the surgery, but I have not had any follow-up.
I mean, you know, people do scar down, depending on how you heal, and almost recreate the stenosis. You can grow the bone back sometimes. I mean, there are a lot of questions. Were you ever fine? Did the swallowing problem ever completely go away and then come back? Generally, we see swallowing problems get better, but not completely go away. But they get much, much better. If it's as bad as it ever was, then I would have another look at it. Yes.
Excuse me. Thank you. When a person who's also completed the Chiari surgery and has improved symptoms, would that person still be considered a Chiari patient for life?
Yes, yes. This is a problem that is controlled by surgery. And a lot of the time by medications, physical therapy. You know, there are good days and bad days, the overcast days, the low barometric pressure, the thunderstorms, snowstorms. All of the patients feel worse. So it's controlled, not cured. We haven't found a cure. I mean, the cure would be probably to, you know, determine the gene and figure out if there's something we can do in utero to keep it from happening. But no, it's just controlled.
Any other questions? One more? Okay. All right, go ahead, Kathy.
Good.
Okay, now we'll try this. Thank you, Dr. Gilmer. We really appreciate you doing this talk.